mister. How can I help you?
Well, first of all, Sonny, I'm not a mister. You can call me Dr. Who's. And second of all, I don't want to talk to some wannabe pharmacist that can only put my money into that cash register over there. Now, where's the real pharmacist?
I'll go get him.
Hi, I'm Dr. Wonderful. How can I help you today?
Well, hello there, Dr. Wonderfully. Taking your sweet time walking over here?
Sorry to keep you waiting. What brings you in today?
I'm looking for some drug that relieves pain and can be applied to the skin. I don't want the pills or tablets because I'm already on too many pills.
Okay, I take it this medication's for you then?
Of course it's for me, you idiot. Can't you see me limping over here?
My apologies, sir. I can see that it does look like you're in pain, and you certainly seem distressed. What seems to be the problem?
Speaking of pain, can you hold on a second?
Sure. Oh, Dr. House, what are you doing there? That's not Vicodin, is it?
Chillax, Mother Teresa. This is just Smartie candies that I put in a prescription bottle for effective communication.
I just died of your arms tonight.
And I'm Asian and not white. I can't possibly be the infamous Dr. House. My name is Dr. Hoos.
All right, Dr. Hoos, so what is the problem?
Well, I am experiencing pain and soreness on my knee.
How would you describe the pain?
It's not too bad. A little bit ache here and there,
Okay.
everywhere. Over down I had a farm.
All right, so what's it look like?
I don't know. Let's take a look.
All right, well, I don't see any outward signs of inflammation or swelling, which is, that's a positive. Have you had symptoms like this in the past?
Yes.
Okay, and what did you take in the past?
Applying heat has helped a little bit, but since I moved here to Florida, it's freaking hot down here. So the heating pad is not an option.
All right, well, welcome to Florida. I certainly agree with you on the heat issue. I think we may be able to find an alternative, but I'll have to ask you a couple of questions just to narrow down our options. You have a couple of minutes?
Make it fast.
I will do my best. When did you start to feel the pain in this recent episode?
It started yesterday when I was moving my furniture into the condo.
Okay, is it from an old injury?
No, in all honesty, I think it's just my arthritis acting up from all the
excitement.
All right. That could certainly be a possibility. What makes it worse?
Well, I don't have trouble putting weights on it, but when I walk for a long period of time, it's starting to hurt a little bit.
All right, I can see where that'd be an issue. What makes you feel better?
Just the heat, but like I said, I prefer something else.
I just want to let you know that this interview is completely confidential, and I don't mean for any of my questions to offend you. I just want to make sure that we have all the information that we need so I can safely recommend a product for you. Now, what other health conditions do you have?
Diabetes, diabetic neuropathy, post-MI, arthritis, GERD, and erectile dysfunction. I occasionally have some trouble with pleasing my wife.
Okay, I can see where that would make things hard on you. What allergies do you have?
I'm allergic to aspirin.
Okay. What was the reaction that you had to it?
I broke out in a rash.
All right. Was it taken by mouth or applied topically?
It's taken by pill.
Okay, that's important to know. Thanks for the information there. What medications are you taking?
Metformin, glyburide, lisinopril.
What herbal products are you taking, if any?
Man, those things are scams.
Okay. Do you drink alcohol?
No.
Okay. Do you smoke or use nicotine products?
No.
All right. Do you use any illicit drugs?
No.
Okay. I just want to see that the data that we've gathered is accurate here so that I can properly recommend the product for you. So you're an elderly man in your early 60s. You're experiencing mild pain in your knee with a history of arthritis, and you're allergic to aspirin. You'd like a topical pain reliever that doesn't apply any heat. So based on what I've just said, does this accurately describe your situation? All right.
Yes.
All right. Well, it doesn't seem to look too swollen or inflamed, which is a good thing. And since it just started yesterday, and you stated that the pain's not too bad, I think we can find something for you over the counter. There are a number of oral medications that may help with your pain and inflammation, and they're usually a little bit more effective than the topical alternatives.
I would really like to try something else that I don't have to swallow because I'm already on too many pills.
That seems to frustrate you. There are several alternatives that can be applied topically. Now, I want to let you know a lot of them contain aspirin, so you just want to be really careful when you're checking for these products to make sure that the product you do select doesn't have aspirin in it. Just because we don't know, since it hasn't been applied topically, and you do have a history of the allergy, we're not sure if you're going to have a reaction to that.
How am I supposed to know?
Well, all the ingredients are listed on the back of the package. It can be confusing, so if you're in any doubt, just ask the pharmacist. That's why we're here. So capsaicin HP, it's fairly common. Most of the things, well, I shouldn't say most, but a lot of the products that you're going to see over the counter that say arthritis relief on them, they're actually containing capsaicin as the active ingredient.
Does it work?
It does work, but it takes time, in some cases up to 2 weeks. It also makes the skin feel hot, which is something that we wanted to avoid with your situation here. You should also know that there's a moderate risk of coughing with your lisinopril, being on the lisinopril. It might be an option, but I think there may be a better option for you. It's not the first thing I'd recommend.
The suspense is killing me.
I know. I'm just trying to make sure you're aware of all your options. I'm saving the best for last. Clark!
Biofreeze.
This wonderful product contains the active ingredient 3.5% menthol, which creates a cooling sensation that helps with the pain associated with osteoarthritis. There have been studies show a decrease in symptoms and an increase in physical performance in patients using Biofreeze to treat osteoarthritis-associated knee pain. You may obtain this product for a one-time payment of $18.95. In addition to taking this product, you can find further relief non-pharmacologically by using RICE. That's R-I-C-E. R stands for rest. You want it to rest the injured leg. I stands for ice. 10 minutes on, 10 minutes off. C stands for compression, and E stands for elevation.
I'm glad you're excited about this, but there's still a few things you should know about the product. You might want to wear gloves when you apply it, or at the very least wash your hands really thoroughly because it can cause irritation to your eyes if you put your fingers in your eyes. You're going to want to rub the gel into your skin not more than 4 times a day. And if it's not feeling better after 7 days, you're going to want to discontinue, all right? Probably the most common adverse effect for this product is a skin rash, so obviously discontinue if a rash develops.
Doctor, my brother of medicine. I'd rather practice beside you than any army of thousands. That no man can get how clever we are. We are lions. Do you know what's there, waiting beyond that counter? It's my drug of choice. I will take it. It's mine. So how soon does it start working?
You will feel an intense cooling sensation almost immediately after applying the product. It should dull the pain. It's called a counter irritant.
Well, thanks, Dr. Wonderful. You sure have been a great help.
Happy to do it. Do you have any questions for me?
Nope.
I'd like to see you again in about 7 days just to make sure the product's working for you. And if it's not, I'd like you to go see your doctor at that point in time.
You pharmacists are seem okay in my book. I'll see you next week.
All right, I'll see you then, boss.
Here you are, Sonny.
That'll be 1850.
1850, huh? Let's see. 1, 2, 3.